Cloud. And welcome everyone. I'm Cassandra Furman. And before we begin, I'm going to ask that everyone, since we only have an hour, why don't we introduce ourselves with your name and the state you're from or program. We'll make it really brief because we'll have time to go back and talk about your interest in performance measurement in just a few moments. If I keep going back and forth as participants come in, we may, there may be some breaks because I have to go back and admit them. I'm Cassandra Furman. I've been with Arch for about nearly 21 years now, and I'm very happy to be here. I have everyone listed in alphabetical order. So perhaps to make it easiest, well, I'll just let you guys decide who's going to go first. Maybe someone, please introduce yourself and we'll just go around the room.
Okay. Hi, I'm Tracy Sinowitz with the Alabama Lifespan Respite Program. I have been the director for about 3 years, and I have been with UCP Huntsville, our parent organization, for 14 years.
Great, thank you, Tracy. Who else is here?
Hi, good morning. I'm Cindy Savarino. I am from the State Unit on Aging in Arizona, and I have been with the organization for 12 years.
Thank you, Cynthia.
My name is Val Madsen, and I'm from Respite Care Association of Wisconsin. I'm the training and development specialist, and I've been with the organization officially just a couple of months, but I've been associated and working with RCAW for the last 12 years.
Welcome, thank you. I'm still admitting people. I keep hearing they're coming in, sorry.
Hi, Cassandra. It's Gina Prest from New York. Abby Lavazzo's here with me as well. We're from the New York State Office for the Aging and oversee Lifespan Respite Grant and also work on our National Family Caregiver Support Program and some state-funded caregiver resource centers as well.
Thank you, Deanna. Next. Anyone go off mute and speak up. If we speak on top of each other, that's okay. We'll figure that out.
Hi, I'm Jeannie Delaplane. I'm from Washington. I'm with DSHS Alta, and I'm the Lifespan Respite Program Manager as well as the Kinship Care Program Manager.
Hi, welcome. Susan and I are both in Washington State.
Hey guys.
Hi, Cassandra. This is Marilyn Sword, and I am the coordinator of the Idaho Caregiver Alliance.
Hi, welcome, Marilyn.
Hello, I'm Lynn Fines, and I'm with the Idaho Commission on Aging and the Idaho Caregiver Alliance with Marilyn, and I'm the program specialist working on the Lifespan Respite and the Dementia Project.
Wonderful. We've got the Pacific Northwest covered. That's good.
Hi, I'm Christine Schoenberger. I'm from Maryland, and I've been the chair of the Maryland Respite Care Coalition for a few months now. I previously served as vice chair for several years, and we are sort of getting a lot of activities started up, so I'm really eager to hear from this group.
Great, thank you. And for the people I've just admitted to the room, we're going down the list and introducing ourselves. When I say the list, you're creating your own list right now. So who's next? Who hasn't introduced themselves?
I'm Brandon Bowe. I'm from South Dakota, and I am the project director for a Lifespan grant here in South Dakota. Happy to be here.
Welcome, Brandon.
Hello from New England. I'm Debbie Lang in Massachusetts, representing the Massachusetts Lifespan Respite Project. And I'm actually here on behalf of Leanne Winchester, who is the project director. So you'll see her face in future meetings.
Great. I just want to get your name written down there so I can check you off my list that you're here. Thanks.
Thank you.
Okay, I've got some people wanting in, so there. Anyone else who hasn't introduced themselves? Oh, I hear some noise. I think there might be, because I see the box light up around your name. I think we're having a little trouble hearing you. We're getting some odd sounds. So I believe that was Nadine Walter, who was introducing herself. Is that correct? Yeah, we can't hear you. I don't know if you're on. Now you're on. Sorry, Nadine. We know that Nadine is here, and Nadine is from Oklahoma. So welcome, and hopefully we can work out that sound problem. Any others?
I hadn't introduced myself. I'm Rachel Hatton. I'm with the South Carolina Respite Coalition. Thank you for having me today.
Welcome, Rachel. And anyone else? We've got quite a large group today, so I want to try and get to the introduction so we can get into the meat of the discussion.
Hi, this is Jill from Arch. I just wanted to say hi to everybody. I'm just going to be a fly on the wall today.
Okay, I believe we'll find ways to get you involved, Jill. Thank you. And I know that Susan is here. Susan, would you introduce yourself?
Yeah, I'm Susan Summers. One of the reasons I wanted to sit in is I'm writing the report from the Research Summit. So I want to hear your thoughts and what you're up to so that I can represent what you're thinking. And I also organized the sustainability learning group, and data collection, performance measurement is one of the key things that grantees and states need to know about for sustainability. So just a little cross-fertilization here.
Thank you.
You're welcome.
Let's go ahead and get started because we really do want to hear from you. I would like to start with a quick poll. So if you don't mind, and what I found yesterday is if you don't hit submit poll, I don't see your answers. So our polling question is, what do you wish to gain from your participation in this group? So I'm assuming you can see the poll in front of you. If anyone can't see the poll, let me know. And you can answer as many as you want. Okay, nearly everyone has gone ahead and voted. So I'm just going to end the polling right now and share the results. It looks as if we're all over the place. And right now, very few people have selected solve a particular evaluation or measurement challenge. And that is probably because it looks as if that most of you wanted to design a comprehensive performance measurement plan. Finding valid and reliable measurement tools, and basically increasing general knowledge about performance measurement. We're going to see if over the months when we meet that we'll be able to meet all of these, all of your wishes. For the most part, we want to rely on the expertise of you. So this whole learning collaborative is not coming from the assumption that Arch knows all, because we really don't. We have some great advisors that we can call on between, amongst the staff, certainly Susan, Jill, Ray, Kirk, and I. We have a lot of background in evaluation and performance measurement, but we really want to rely on the expertise of you guys on the ground. So I wanted to provide a little bit of an update of ARCH activities related to performance measurement. Some of you are already familiar with the guidance that we produced a few years ago on performance measurement. That's on our website. If you're not familiar with it, I'll be happy to just let me know, and we will send those links out to you again. Also, anyone, show of hands or put something in the chat box. Anyone attend the research symposium we just had a few weeks ago? One, hey Brandon. Okay, a couple. Lynn attended. I can see your faces, so I'm answering this. So that was really exciting for me to see all of the interest and so much great stuff going on in research. So right now, what I would like to do, unless are there any questions anyone has about the activities that we've had to date? Any questions about that? Okay, then let's get right into hearing from you guys. Please first of all, we'd love to be able to see you. If you have video capability, please turn it on. If not, don't worry about it. We'd love to see what you have to say anyway, we'd like to hear from you. So please unmute your computers or unmute yourselves. And what I would like to hear from you are, what expectations do you have? So we did a polling question, but I'd really like to hear more specifics about your expectations for the collaborative, what you can bring to the collaborative, any performance measurement and evaluation activities that you're conducting. So I'm going to zip my lips for a while and I want to hear from you. So what are your expectations? What are you doing now? How can we help? And we means the whole group. And if you happen to be talking and you're on mute, we can't hear you. So is anyone collecting data? And what are you collecting data on? Maybe we'll start there. Who's collecting data?
Cassandra, at Alabama Lifespan Respite, we are collecting data, and we always have, but with our newest Lifespan Respite grant, we specifically are collecting data about stress levels of caregivers before and after receiving respite. And so we want to hopefully see a decrease in caregiver related stress after receiving respite. That's the goal. We want to decrease that stress. So, we are asking very basic questions this year. Are you experiencing stress, and on a scale of 1 to 10, that's before, when you apply. And then after you receive respite, how do you feel now? Has your stress level decreased at all? And, once we maybe see how that goes, we may try a different tool next year for next fiscal year to measure the stress level of our caregivers and see how respite affects it.
So how many of you are other people collecting information on caregiver stress?
Cassandra, this is Cindy from Arizona, and we are.
What measures are you using to collect it?
We have a caregiver assessment tool that we developed with Arizona State University, Dr. David Kuhn, years ago, and we use it. We have a pre and post test that asks a variety of questions, and we determine then their stress level based off of those questions.
Others, because I'm very curious on how you're collecting it and what tools you're using.
Yes,
Cassandra, Lynn, go ahead.
Yeah, no, Marilyn, you go first.
Well, I was just going to say, we have just begun implementation of a family caregiver navigator project, and we're using TCare as the platform for that. And so part of what we're measuring in that is several domains of caregiver stress, identity discrepancy, caregiver load, depression, some factors that would help us craft a plan for caregivers to help build their resilience. So right now we're using the Tailored Care TCare platform and the instruments that are attached to that to get at that information from caregivers. It's not specific just to respite.
I'd love to see that tool. Is that something that you can share with others? Is it?
Cassandra, what I would suggest is that if you go online and you just Google Tailored Care or TCare, it was developed by Dr. Rhonda Montgomery at the University of Wisconsin-Madison, and it's being used around the country. We're kind of late to the game. It's the Washington State Family Support Program. It's really embedded in what they're doing. So
we're late to the game
better
too, Marilyn.
sources than us. Pardon me?
I said we're late to the game too. This is Dina in New York, and we're actually getting ready to pilot TCare in 10 of our counties starting in 2021. So we're excited about it too.
We need to keep talking.
Yeah, sounds good.
So TCare looks at a number of things. It looks at stress, caregiver load. What other data elements does it look at?
Well, there's an initial kind of 5-minute screening that gathers demographic information as well as some basic elements like that. And I can send you the link to our Navigator website, Cassandra, because that short screener is on there. And once the caregiver has responded to those questions, it brings up a dashboard that says whether you high, medium, or low in terms of stress levels and some broad domains. And then the navigator reaches out to the caregiver and they do a more comprehensive assessment that then is used to drive a caregiver plan. So I can send you, I'll put it in the chat, the link to our Caregiver Navigator website, and that has that on it.
Thank you. And Jill just put in the chat, and that's true, we have a selection of tools on our website, and she sent the link. I'll make sure that everybody, if you would like, after the meeting, I'll collect all these links and send them out to the group so that you'll all have this information and you don't have to worry about downloading it right now. I'll make sure you get it. So that's, let's hear about other people's data collection efforts. Thank you so much, Marilyn. Anyone else collecting data, and what elements are you looking at? Because I know Lynn was about to speak right before Marilyn started. Yeah.
Yes, well, we're doing the same at the grassroots level. We're collecting, we're doing a stress burden test on the caregivers before and after. We're doing a pre-post survey before and after receiving services. Yes, we're looking at their income level, below poverty or above poverty levels, things like that.
This is Jill. Can I just interject a point of clarification? There's no judgment about this at all, but it would be really helpful to Arch if you, when you're talking about these tools that you're using, if you could let us know if this is for the Lifespan Respite Grant activities or respite services you're delivering through the grant or for another project, because some of these probably go beyond Lifespan Respite Grant activities, but we want to hear about everything, so this is great.
I'll go now. We also collect pre and post data for our voucher recipients, and that's funded through Lifespan activities and also in the past through state voucher funding and some private donations. We also, for the first time, we did a statewide caregiver survey, And we used questions from Wisconsin for portions of it. And then we also developed our own questions that were specific to caregiving needs before COVID-19 and after COVID-19. And we disseminated this through our regional advisory councils and our state committee on respite, and then our general network. And it was open to caregivers regardless of if we were serving them or not. And it also collected a lot of information about other services they received and that kind of thing. And sadly, we only had 130 respondents. So it's not something that we feel is like really generalizable, but that it gives us a good starting point to be able to build this in future years. I have a background in research. I worked for National Institute of Mental Health study for 6 years. And so that's one of the things that I've really tried to do is like look at all of our services and how can we get some good measurements out of that. And we've started that and have some solid reporting, but you know, I'm hoping that through this collaborative, we'll get other ideas for other ways to do it and to get more information.
130 sounds pretty darn good. We should not be apologetic.
I was hoping for a lot more than that.
Well, we always do, but you know, when people apologize for the numbers, it's usually, well, we got 10 surveys back. I wasn't expecting 130, and your apology.
Yeah, we got 130, but I was hoping for a few hundred. So, yeah. But yeah, we were excited about that, and we use I don't know what other collection systems everybody's using, but we use JotForms because it's really easy, and it's you can get the HIPAA a HIPAA agreement so that it's secured.
So are you able to share some of the information about the JotForms?
So yeah, I mean, we when we started this, we used Google Forms because it was free and easy, but it wasn't very secure. And so we because one of the surveys that we do for another program does have HIPAA EPI that we have to protect. And so we use a system called JotForms, and it's only like $20 a month, I think. But that's for one seat, but we're small, there's 6 of us. So I do all of our surveying, and you can get them to sign a HIPAA associates agreement. And so we have that, and then it's really, really easy to build surveys in, and we send them out electronically and get the results that way. And they also have like a compiler in there, so you can export all of your data into Excel, or you can have it generate data visually. I'm having trouble talking today. Data visualizations within it, so it's really easy to use.
Rachel, I want to talk to you later.
Yeah, we love JotForms. It's really easy to use.
Yeah, I would really like more information on that, not only for Arch, but for other projects I work on. That sounds, I didn't know about it.
Yeah, we love it. We love it. You can also use it for event registrations, and it's got a whole lot of stuff you can use it for besides just surveying.
Great, thank you.
Thank you.
Any other data you're collecting? I have a very specific question. It sounds as if you're getting a lot of focusing on caregiver and how respite affects them. Are there any other things you're collecting data on? For example, one of the purposes of Lifespan Respite is really creating systems change that support respite. Those are my words. Anyone collecting data on systems change?
Hi, in Massachusetts, because we're bringing together an alliance of various state agencies that provide various kinds of respite services. That in order to bring folks together to one, we've been talking about creating a sort of standard definition, and then really looking at how these various agencies are actually what's the utilization and cost and so on. And so in pulling this alliance together, one of the things that we're actually doing around evaluation is measuring and saying that it needs to function as a collaboration, because these are all very distinct and robust agencies that if they're going to look at this in a statewide way and think about a systematic change, that in order to do it, it has to be collaborative. So we're actually measuring a level of collaboration and really defining collaboration and having it be as front and center as possible, and actually measuring how it's working. Because ultimately, everyone's been operating in their own way, and if we're really going to look at it in that broader way, it has to be done through this collaboration. So that's, and it's a tool that I had learned about that's actually called levels of integration. So we're actually using a rubric and taking different measurements in terms of how how this alliance sees itself as it aligns with other agencies, and what needs to happen in order to collaborate, what's happening now in terms of the level of collaboration, but really thinking, well, where do we need to be in order to reach the goals of the project? So it's been a very interesting, of course, COVID has really made it very challenging to bring together a strategic alliance, but we carry on.
I would just love to see that tool, the levels of collaboration tool. I hope.
And I'm not sure if Leanne has been, I know that she's talked about it in other meetings, and I don't know whether it's been related to this at all. So I don't know whether you've heard her talk about it, but in any case, by all means, happy to share.
Great.
She has talked about it on the sustainability work group, but I don't think we've actually seen the tool.
Oh, okay. Well, I don't want to speak for her, but if she's offered to share it, then I will definitely talk to her about that.
She
That would be
shared
great.
information too during the research summit, and there was a lot of the discussion coalesced about what you're doing in Massachusetts. So I think what you're doing is really important for all of us to learn how to understand, to take stock of what's going on in a state and learn how to understand, to work collaboratively and really capture the whole of respite rather than little bits of it. So
Right.
good for you.
Well, thanks.
Are there any other types of data you're collecting? I mean, caregiving, it sounds as if we've got at least one state, and probably they're more doing systems change collection. Is anyone tracking, for example, usage of respite, gaps in respite services, anything like that?
Cassandra, this is Tracy in Alabama. Last year, we did collaborate with the Alabama Department of Senior Services, who is, our collaborative partner on the Lifespan Respite Grant, to survey caregivers and providers statewide to learn more about the availability and the capacity of caregiver support services in our state. And then all of that data was compiled and formally presented to our legislators in a white paper, because our ADSS, the Department of Senior Services, is working with our legislators to address some of those gaps. So this is some of the research that they used to help those conversations along.
Could you, you mentioned it was published in a white paper. Is that something you can share with the group, that white paper?
Absolutely, I can do that.
Good, I would really like to see that.
Sure.
Any other data collection that's going on that you'd be willing to share with us right now? Okay. let's talk. I've got these ideas in my head about how we can use this collaborative. And right now, so I'm gonna try really hard not to say them, but I've got so many great ideas from what you've shared that I want this to be yours, not mine. So we want to identify and plan how we're going to use the collaborative in future. So I'd like to hear from you how this group could help you, what you really want to dig in. How would this be of the greatest benefit? What format should we use? So I'd love to hear. And you have to be careful, because if someone doesn't talk, I'm going to tell you what I think. First, Jeannie, I'd love to have that cat right now sitting on my shoulder.
I'm so sorry. He's yeah. This is Zen.
That cat would be very comforting. So one of the things one of the things that I would be very interested in is learning more, almost like mini presentations from the people in the group. I would really love to have a robust description of the, I'm trying to find it in my notes, my handwriting is so poor, the JOT system. I don't know if anyone else found that interesting. Well, I'm certain you did, but that would be something that I would really benefit from. Oh, here she is. She must have been kicked off. There's Rachel. She told us about it. Okay, she's coming back in. Rachel, I was just talking about you. I see you disappeared for a while. She's connecting. But I was thinking that it might be really valuable for me, and I don't know if it would be for the group, but to hear more, maybe have mini presentations on the data you're collecting and the systems you're using. So with Rachel, who I think she's disappeared again, but would that be of benefit to you? What would you think about that for maybe Massachusetts, sharing some of the ways they're doing their levels of integration? More about the utilization of respite. What are your thoughts?
Yeah, thoughts. Sounds like a great plan.
Yeah,
Great idea.
I agree. I think that would be beneficial.
Are there any challenges that you're facing right now that you would really like to make sure that are addressed, that we either have mini presentations or just general discussion about?
Cassandra, this is Marilyn, and I'm sitting here looking at our lifespan respite logic model, and so much of what we're trying to change is things like awareness, levels of knowledge, attitudinal change, behavior change, and then systems change. And so anybody that has any tools that help quantify those kind of difficult to measure things would be really helpful, I think, for Lynn and I, and probably for others as well. It's just, how do we can do pre and post interviews or surveys, but how do we really get at the level of information that we really need, that policymakers want?
First of all, I'm just delighted that you have a logic model. That's wonderful, because you've spelled out what it is you want to measure. Awareness, level of knowledge, systems change. Does anyone else? Anyway, that to me is fast. Now you need to figure out how to measure them. Would it another possibility I can throw out is, would it be of use for us to share our logic models initially, like early on? Maybe if you didn't want to share them with the whole group, if you sent them to me and I could sort through and find those data elements that you're trying to measure, and then we can work on those.
Or project goals as well, Cassandra?
Project, you know, a lot of people use different terms. So your logic model might talk about outcomes, it might talk about project goals, it might talk about performance measures. But if you submitted them, and a lot of people don't want to share them with the world, if you'd be willing to share them with me and I could sort through them and pull out some of the main, would that? And some of you, if you don't have logic models, it might sort of help you as you move along towards logic models. What other challenges are you facing? So one thing I just heard, I love it, finding tools. And if people in the next few weeks can send me your logic models or the goals and objectives that you're working on, I can send it back to the group and we can start finding ways to dig deeper into that. Any other challenges people are having right now that you'd like to grapple with? Because today we're just planning our collaboration. How is it going to look? What are we going to do? I've been told I need to learn to live with painful silences.
And that there's a lot more painful silences in virtual meetings because it's hard to read the room, right? So I just wanted to thank you for pulling this together because I think it's really important. Like Marilyn was saying, like I think one of the challenges is measuring things that like go into system change, and so we've been. I think there's 10 other. And they're not using anymore, but there's 10 other states who are piloting the data collection tool. And so we've been using that and submitting it with our lifespan reports. But it's really hard to like figure out exactly how to measure some of the things on there too. And so, you know, we sort of set aside, like we're using a really low-tech Excel spreadsheet to track when we do outreach activities and how many people are there and that kind of thing. But that's not like outcomes. That's who's there and how many things you did. That's, you know, like, so what I'd really like to see is how can we move from collecting that kind of data to actually having outcomes measures related to that. So we have started trying to do more like pre-post tests at events and things, but now that we're doing everything electronically, that's kind of hard to gauge too. And a lot of times, like you're like one person at one of those events, you know, and it's not like your event, so it's hard to get them to give you data. So I don't know. I'd like to talk and think about how other people are getting information about that.
Yeah, I mean, on that same note, I mean, I have to add in there, how are we overcoming these COVID challenges? What are you doing? What are your initiatives? What are your innovative ideas? I think that needs to be put on the table.
Yeah. And Susan, you could probably really help with that.
Yeah, I would love to help with that. Kim Whitmore from Wisconsin and the Break Exchange did an international survey. I'm helping her with the research design and the analysis. And we do have a framework. I was going to put something together actually for the sustainability group this Friday, so they could kind of, one of the questions we look at in sustainability is what are you sustaining? And that what you're sustaining may look really different right now than it did a year ago. So I will share that with this group as well, so you can at least see what's going on in the caregiver community. And then along with that, the Carter Foundation in the care provider community, the Carter Foundation just did a study on how COVID has impacted caregivers. And there's considerable overlap with what they found and what Kim and I are finding among care providers, and some important differences too that would be worth your while maybe to look at. So I'll pull those together for the sustainability group on Friday, and I'll share them with this group, give you something to think about and maybe measure in your own states.
Lynn, also, I know you weren't here in June, but we had an incredibly productive Lifespan Respite grantee meeting for 2 days, and it pretty much focused on what states are doing with their Lifespan Respite grant dollars during COVID. And so there's lots of wonderful examples from that grantee meeting that you could take a look at. And we also have resources on our COVID resource pages as well.
This is Dina from New York. I just thought I would share something that we just started to do for our new grant. And Abby may want to chime in and give more of the specifics because she's been working on it, but she developed a Gantt chart to use for tracking our Lifespan Respite deliverables for the new grant. You know, we had a few different systems we had tried with kind of tracking the activities. We do bi-weekly calls with our team, which is the coalition and one of our area agencies on aging, Monroe County, who we work with on this initiative. And so, you know, we're in constant communication of being able to hear what's going on, if any adjustments need to be made. But we did feel like this might be a better approach. Abby did this, I think, for another initiative and thought that it just seemed like it would be good to try with Lifespan Respite. So I'm going to turn it to Abby just to give, I guess, a little bit more of the specifics, but we're actually haven't launched it yet. We're planning to do that and show our team this Tuesday and see if they're agreeable to using it. But I think, you know, it looks like from what I saw so far, I think it's going to work well with showing percentages and things of how far you've progressed. You want to talk a little bit, Abby, about it?
Yeah, so I developed a Gantt chart and it outlines it's in an Excel spreadsheet. So it outlines the goals and outcomes and the objectives of our grant proposal. And then each year is broken up into different tabs on the Excel spreadsheet, and it outlines the tasks for each objective and what months throughout the year the task should be worked on. So if you did something from September to December, you could fill in that it was completed, and it automatically will show the progress, like how much you've done towards getting to 100% of your goal. And then we also created an accompanying Word document that outlines the tasks, and we'll send it out to our partners, and they will put in there, you know, what they did that month to achieve that certain task, and we'll discuss it on the bi-monthly calls like Dina shared.
Well, I'd love to see that system at work.
Yeah, as soon as we get it launched, we just, you know, kind of wanted to pitch it to our partners, and if they're all agreeable to giving it a try and using it, we'll be happy to share it so that folks can see, you know, how Abby developed it. But I think it'll be helpful even for us too, with just, I think, you know, making sure that we're capturing everything in our report to ACL as well. You know, because there's a lot of things that happen through the coalition that you try to make sure that you capture all those details, and you don't always get them all. So we feel like this system may help with that as well. And I did want to, just because I have your attention, I didn't want to take time away from others in speaking. I don't know how many of you participated, you know, in the research summit, but our evaluator, Dr. Caprio, did do an awesome job with kind of covering all of the data elements that we track here in New York. But
You know, I can just briefly share, because we do have a logic model, so we can share that with the group. But, you know, we track our coalition building as far as, you know, membership and the monthly participation in monthly calls, website utilization, our newsletter distribution. As far as trainings, we are in, you know, we have the respite education and support tools here in New York, which I know, you know, we are in the midst of rebranding and having it be New York specific, since REST has kind of closed up shop, so to speak, but has given permission for all the materials that we purchased to continue to be utilized. So we do track a pre and post assessment and a number that are trained for this trainer curriculum. And we also, you know, the caregiver simulation, thank you, Alabama, that's now here in New York. Doris does a great job with tracking those trainings and collecting data on the experience for participants, powerful tools, mindfulness, and then as far as respite care, the number of hours of respite delivered and the number of volunteer hours. So we track a lot in regards to that. Some other things that we do that really kind of fall here to the State Office for Aging is our ADRC program, our No Wrong Door with New York Connects. We actually also track the number of respite services that are listed within the resource directory and the utilization. And then our mini grants, that is how we actually deliver respite. There are required data metrics and progress reports that they must, you know, share specific data with us in receiving that funding. And we, I would say, just looking at our logic model, I guess just some other things that to note is that, you know, for future, and part of the reason that we're launching the pilot for using the T-Care assessment tool is that we recognize that, you know, the outcomes that can provide, it seems really robust, and sharing some of the, you know, the things that we feel like we're missing as far as the caregiver experience, right? Really coming from the identity discrepancies that seems to offer. So we're excited about that. And I advocated for, because this was really being launched within our area agencies on aging network, and we had 10 that volunteered to have staff work on it with 20 users. But I actually advocated that we have the coalition be part of the pilot because I feel like, knowing that they work with caregivers across the lifespan, that it would just be you know, valuable information to collect in a pilot to see, you know, how the tool is being utilized with some of those caregivers instead of just our, you know, primarily our caregivers of older adults. And so we're excited that, you know, our agency, State Office for Aging, was agreeable to having the coalition take part in the pilot. So I believe they're going to have at least 2 users that will be working with us during the 12-month pilot.
Thank you. You know, believe it or not, we've only got 10 minutes left. And this has been such a great conversation. Originally we said we'd meet quarterly. I have a feeling that there is so much going on here and so many questions that it might be better at least to have another meeting in a month. And today is what, the 3rd Wednesday? I'm wondering if I just scheduled something same time on the 3rd Wednesday of November, unless it happens to be the day before Thanksgiving. Or I could, is it? I see Lynn looking at her calendar. Is that the day before Thanksgiving?
Well, it's the 18th of November, and I can tell you already I have a meeting planned.
Well, how about I send out another doodle poll, and maybe we can do it after Thanksgiving. What I would like to hear, I think the fastest way we can do this is use your chat box, but could you, you know, I've heard some different things we could be doing. Before we meet, if people sent me their performance, their logic models, their goals and objectives, and I can share that, all aggregate it all and sort of share it with the group before we meet so we can start looking at ways of measuring that. I was also thinking that it might be good for us to have mini presentations from people in the group. There's so many great possibilities of what we would learn about. Could you put in the text box, we'll start right now with, the first thing, what if we, for the next meeting, what would you want to hear about? What presentations would you like to hear about? And we'd maybe take 10 minutes per presentation so that we can follow up with discussion. So if you could put in the chat box what you'd like to learn more about. We may not be able to hit it all the next time we meet. I'll send out a doodle poll, but I'd love to hear from your chat box. And unfortunately, Nadine's left already, but was there something that struck you today? Challenges and barriers overcoming. And I know what I want to hear about. Falls of pre-post measurement, roadblocks and successes. Great. I'd love to hear about measuring usage of, all of those. Thank goodness we have someone with an open heart. Oh, Brandon, thank you. Okay. So I think we have as many people who are going to respond as possible. What I'm going to do before we meet again is I'm going to send out a doodle poll. We'll try and find something after Thanksgiving when we can get back. If you can send me your, I'll send you the chat so you'll have all the links. In fact, I'd better save it now before I forget. I'll send you all the links that we discussed in the chat, and I'll invite a few people, if that's okay with you, to do mini presentations on some of the things that you have identified, but we'll try and keep this open-ended discussion about, I see the pitfalls of pre-post, the just challenges and successes. And right now my mouse is not happy. I want to save this post or save this chat. Next time I might ask Susan or Jill to help me out with.
I've saved the chat, don't worry.
You've already done it. Okay, thank you. That saves me time. Okay, and how the other thing, I'll in the doodle poll, I'll get feedback from you about the length. Do you think maybe we can keep with an hour, because we've made it within an hour this time? But if the conversations and the presentations lead to a lot more conversation, maybe we can save a half an hour and say an hour and a half, schedule that, but plan on an hour. Does that sound good? Any further discussion before we close out the meeting? Don't be surprised if I email you individually and ask for more information about what you shared today, because I'm fascinated. Jill, do you have any comments? Susan, before we go?
Well, I'm just delighted that so many of you are engaged and interested in performance measurement. And we're so lucky to have Cassandra and Susan both, who do have a lot of expertise in this area. So let's take advantage of them.
Well, I'm glad that we've got the rest of the group who seem to know a lot too. Thank you so much for joining us, and look forward to my doodle polls and notes. Bye-bye.
Thank you, Cassandra.
Thank you. Bye-bye.
Thanks, everybody.